Welcome to Ursuline College of Somnia Nurse Anesthesia Program's webinar series. My name is Dr. Stephanie Woodruff. With me today, I'm really excited. It is Dr. Barb Douglas. Thank you so much for coming, Barb. I really appreciate it. So can you tell me a little bit about yourself? We're going to talk about your DNP project.
Sure, that's exciting, and thank you for having me also. Well, to start with, I've been a CRNA for 32 years. I've worked in most anesthesia settings, from large academic centers to solo office-based cases. I'm currently working at a critical access hospital with 3 other CRNAs working independently. I'm very fortunate to work with my colleagues. We truly work as a team, support and collaborate with each other to provide comprehensive anesthesia services. I wanted a DNP for 2 reasons. First, I wanted to learn the skills to critically analyze my practice to find ways to improve. And secondly, I saw our national organization moving forward towards DNP as an entry-level requirement, and I wanted to stay current with my educational standards. Just prior to this, getting my DNP, I went back to Ursuline and got an MBA that focused on healthcare administration. And after 20 years of just practicing, raising a family, living a normal life, I started to branch out, and I really enjoyed it. So that was another contributing factor. Yeah.
You could do so much with the nursing degree.
I found learning was fun again.
Yeah.
It's so diverse.
MBA.
Yeah.
So what was your project, and how did you come up with that idea, Barb?
My project was to implement an anesthesia-specific quality improvement program in a small independent CRNA practice. This was modeled after the Institute for Healthcare Improvement's triple aim at the time, now it's a quadruple aim concept, to first find anesthesia-specific quality outcomes, anesthesia-specific HCAP scores, and then do a cost analysis with a global idea of trying to reduce anesthesia costs by 5 to 10%. I'd love to tell you I had this great idea off the bat, but I struggled. Coming up with an idea was a challenge for me. I didn't come into the program with an idea in mind. In fact, I really didn't appreciate the extent of the curriculum prior to enrolling. I took each class. I tried to come up with an idea that was both interesting to me, but also something that would contribute to the practice of a CRNA, particularly independent CRNAs. That's a focus of mine. I dabbled with a political agenda somehow, advancing our profession. I explored the concept of substance abuse addiction among anesthesia providers, but then I saw the IHI's triple aim and realized that all scores for quality, both outcomes and HCAPs, tend to be in a multi-specialty bundle. For example, 30-day outcomes, readmissions, bundled payments, everything's lumped together. I love the idea of shrinking this idea down to anesthesia specific. And more specifically, I wanted to collect outcome data from independent CRNAs practicing to be used in studies to prove safety and effectiveness of this model.
That sounds so
That was my overarching goal.
Yeah, I would love to read that project. That sounds really fascinating. So on your project, you had some team. You had your own team, right? So can you explain your goals of that team?
Well, first, to begin with my chair, I chose Dr. Mary Beth Zenny. She was one of my current instructors at Ursuline. She's well-versed in academic requirements, but also she's just a very personable, she's a lovely woman. She's very easy to talk to. She's very approachable and helpful. She was always readily available for questions, meetings, or any other guidance I needed. For that matter, as a whole, the faculty at Ursuline was very easily accessed and responsive during my program. So to me, that was huge, having somebody that I could actually go to and ask questions. My advisor was Dr. Sonia Moore. Some of you may recognize her name. She's known nationally now. I chose Sonia for several reasons. She is the director of the Francis Payne Bolton School of Nurse Anesthesiology, so I've also known her for many years. She knew me well, and she knew the specific requirements for successfully completing a project. That to me was easy, asking Sonia, and she was very helpful. My mentor was a different story. I selected the CNO at a small independent orthopedic hospital where my CRNA group was providing services and where I was implementing my project. This hospital was unique in that it was occupied by only a couple of floors of a previously known St. Elizabeth's Hospital in Dayton, Ohio. So it was one of these large hospitals that systems that shut down, and then they started leasing out different floors of it. Our group was brought in as a cost-saving measure, replacing a well-known MDA CRNA group in the area. Long story short, this was a struggling venture that has since closed. During my implementation phase of my project, my CNO was fired, illustrating some of those unknown barriers that will reveal themselves during the project. But I survived and made it through. But things happen.
So, yeah, you have to pivot, right? That's life.
You have to. That is life. You have to pivot. Yeah.
Well,
so I was just trying to pick somebody that was within that system, and actually that tied me to the administration to be able to actually conduct the project.
So did you have to pick another mentor?
I'm sorry, I didn't hear your question.
Did you have to pick another mentor? I mean, how did you change that?
It was well into the program, and then I just referred to one of the administrators, but it wasn't a nurse. It was one of the administrators then that continued, to help me through the project.
Wow.
We everything had been approved; it was already underway, and then next thing you know, there we are. So,
well, you're not the last student to have a hiccup with the DNP project. I mean, I can go on and on and on about previous students and myself having hiccups in projects. So you just pick up and move on. That's part of being a CRNA as well. So thank you for sharing that. So could you tell me about the different stages of the project? Planning, implementing, evaluation?
This is the planning. I think the most critical part is identifying and understanding the problem, which is also identifying what your project is going to be. But then clearly identifying the problem was my first step for a focused project. The coursework all contributed to clearly creating a problem statement through a systematic review of literature, developing a PICO question, clearly stating my problem, identifying a conceptual framework to help organize and support my claims, identifying stakeholders, populations. But to simplify, what I needed to do was the necessary assignments, a needs assessment, review of literature, to all clearly identify the problem and set the stage for a focused and manageable project. Implementing to me was the fun part. I was able to take an idea and form a concrete plan and either prove, disprove, or find new information based on specific metrics using valid and reliable tools for assessment. I found other experts in the field had also looked at finding anesthesia specific HCAHPS and outcomes, but they weren't widely used. And to my knowledge, I really don't think they are being widely used yet, certainly not in my current group. This also forced me to narrow and keep my focus, develop methods for collecting information, develop process evaluation and outcome questions, all meant to keep my project on track. It's far too easy to lose focus, pull information in, although it may be extremely important, but if it's not part of my identified problem, it's not part of your project. And that was a hard lesson for me to remain focused. Evaluating and compiling this mountain of information that I collected, which it was a mountain, was daunting at first. But by having but I established the criteria for my assessment during the implementation of the project. And so if I stuck to that, my goals were identified. I will tell you where I fell short was in disseminating my project. First of all, I didn't tell you this earlier, but I didn't do this electronically. So this was just paper. And that was ridiculous. So maybe this was years ago now, but everything should be electronic now so that you can actually connect in all these systems and make every piece of data usable. So I could have improved on disseminating my project. I had a lot of very good data demonstrating how to use triple aim and how it could be imagined for any department or organization. I presented my project at the IHI conference in Orlando, and a representative from JACO actually approached me about it. He encouraged me to submit an article to their newsletter. I did. I submitted it. It was rejected. And with him saying, quote, he didn't feel that the AAA was intended to be used in this manner. Oh. I let this discourage me, and I did. I let it discourage me, and that's a mistake because it's a framework. I used it differently, but I used it exactly the way it was intended. but I should have pursued that.
Well, lesson learned, right?
Lesson learned. Yes.
Lesson learned for sure. With life, lots of lessons with life and experience. So, how do you see yourself growing professionally as a result of completing this DNP degree?
In hindsight, the professional growth is what surprised me the most. Professionally, I learned new skills to critically analyze literature, identify problems, and approach and offer solutions for advancing and improving care for the patients we serve. I learned that improvement in best practices is based on these learned scientific principles. So it was surprised me that there were concrete things that I could do to improve our practice. I also have been exposed to many other opportunities as a result of earning a DNP. As an advocate, I served on my state association, OSANA, first on the nominating committee, and then I moved for different roles like the board of directors, treasurer, vice president, and then president. This led to serving in a regulatory role, and I was appointed to the Ohio Board of Nursing by former Governor Kasich. While in the OBN, I was awarded an opportunity to do a postmaster's certificate at George Washington University. The course was Healthcare Policy and Media Engagement. And from this, the opportunity to become adjunct professor, and here we are at Ursuline College. And these are just a few examples of how advancing and staying current in our career have opened numerous opportunities that I previously have not imagined.
Wow, what a story.
Yeah.
That's fantastic. That is absolutely true. The DNP degree will just open doors for you that you don't even know that they'll open. I really appreciate you spending your time, your day off with me, talking to me about your project and your accomplishments. And I really look forward to working with you in the future.